Hi everyone, my name is Janae Chamberlain and I am the Stroke and Quality Coordinator for IU Health West Hospital, and we're here today to talk to you about stroke. In case you don't know what a stroke is, we're going to go through a few of the different types of strokes that we usually see. There are only two, so the first one is when a clot breaks off and it can travel throughout your brain. Sometimes the little clot can move through without any issues, but there are other circumstances where it gets into a smaller vessel, or maybe you have some cholesterol and it gets held up, and at that point the blood can't get through. So that is what we call an ischemic stroke, and your symptoms will depend on where the clot is. The second type of stroke is from a bleed, and this is complete opposite. So one of the blood vessels in your brain might have been weakened, and say you have a spike in blood pressure or some kind of trauma, that blood can leak out into the brain. The biggest issue with that is your brain is in your skull, which is an enclosed area, and it's a hardened area. So the swelling has nowhere to go other than down. So that is what we call a hemorrhagic stroke. The treatment options are completely different, but the signs and symptoms can be very similar for both. What are the signs and symptoms, you might ask? We're going to take it away to Blake so he can explain the stroke signs and symptoms.
Hi, my name is Blake, and I'm an emergency medicine pharmacist at IU Health West Hospital, and I'm here to talk to you about the signs and symptoms of stroke. Did you know that according to the CDC, in the United States, someone has a stroke every 40 seconds? Every minute, 4 people die of a stroke in the United States. Stroke-related costs in the United States came to nearly $46 billion between 2014 and 2015. This amount was totaled from the cost of healthcare services, medications to treat strokes, and missed days of work. Stroke risk can increase with age, but they can occur at any age. Given these statistics, it is extremely important to recognize and act when stroke symptoms are discovered. The quicker you arrive in the emergency department, the higher your chances are for a better recovery. B FAST is the best acronym to help you remember the symptoms of a stroke. B is for balance. Any sudden change in balance could be concerning for a stroke. E is for eyes. Any sudden change in vision or losing vision in one part of your eye can also be a less known sign of stroke. F is for face. If you smile, you can't see mine, but if you smile and one side droops, that should be a cue to call 911 quickly. A is for arms. If you hold both of your arms up and one side slowly drifts down or can't be moved at all, this is concerning. S is for speech. If you can't speak clearly or you have a hard time getting your words out, this is also a concerning sign for stroke. T is for time. The quicker you get help, the more treatment options we have when you get here to the emergency department.
Jim Fazenmeyer. I am a neurologist and I'm the medical director of the stroke program at the Indiana University Health West Hospital. So now that you've learned a little bit about stroke and the signs and symptoms of stroke, we want to do a little bit of ways to try to prevent a stroke. So there's several risk factors for stroke. And if you think about the risk factors for heart disease, they're very similar. So we want to try to control blood pressure, so hypertension is a risk. Smoking is a big no-no and it puts an increased risk for stroke substantially. Diabetes and high cholesterol. And then there's another risk factor, particularly for stroke, and that is something called atrial fibrillation, which is an irregular beating of the heart. And what happens with that condition is blood clots form in the heart and then flip off and go up to the brain and cause a stroke. So if you have atrial fibrillation, then it's very important to take blood thinners to prevent those strokes. And it's more than just taking aspirin. These are drugs like warfarin and then the newer drugs that we use to prevent those strokes. Sleep apnea is also a risk for stroke. So if you have sleep apnea, we want you to try to get that treated. And weight loss is another important way to try to reduce the impact of sleep apnea, and it also reduces the risk of diabetes. So if you really can try to do those things and essentially try to stay healthy, try to exercise, that will reduce your risk of having a stroke in the future. So although if you do have a stroke, we want to treat it, the best way to treat it is not to have one in the first place. So we wish you the best and thank you for taking the time to watch this.